Living with asthma involves careful management and awareness of potential triggers, including medications that might exacerbate symptoms. Understanding the medications to avoid when you have asthma is crucial to maintaining control over this chronic condition. Here are the top 10 medications to steer clear of. Number 1. Aspirin and other NSAIDs or non-steroidal anti-inflammatory drugs. When managing asthma, avoiding NSAIDs like aspirin, ibuprofen, and naproxen is crucial. These medications, while effective for pain relief and inflammation, can trigger or exacerbate asthma symptoms due to their potential to induce sensitivity reactions. A study in the American Journal of Respiratory and Critical Care Medicine highlighted their association with increased asthma exacerbations. Dosage varies among NSAIDs, and it's essential to follow healthcare provider guidance, taking them with food or water as prescribed. Adhering to recommended dosing schedules helps minimize potential side effects such as stomach irritation, ulcers, and aggravated asthma symptoms. Number 9. Beta blockers. Beta blockers, commonly used for hypertension and heart conditions, pose risk for individuals with asthma. These medications can narrow airways, potentially leading to breathing difficulties in asthmatic patients. Research from the Journal of the American Medical Association underscores the possibility of inducing bronchospasm in these individuals. Dosage varies depending on the specific beta blocker and condition being treated, necessitating strict adherence to prescribed dosing intervals. Side effects might include fatigue, dizziness, and exacerbation of asthma symptoms, making careful monitoring essential. Number 8. ACE inhibitors or angiotensin-converting enzyme inhibitors. While ACE inhibitors like enalapril and lisinopril are beneficial for managing high blood pressure and heart failure, they can lead to persistent coughing in some individuals, potentially mistaken for asthma symptoms. Studies published in the British Journal of Clinical Pharmacology emphasizes this association, urging caution for asthmatic patients. Dosage specifics vary depending on medication and individual health factors. Proper adherence to prescribed dosing schedules is crucial to avoid side effects like increased blood potassium levels and persistent coughing, often associated with ACE inhibitors. Number 7. Sulfites. Sulfites, commonly present in medications, foods, and beverages, can trigger or worsen asthma symptoms in sensitive individuals. Avoidance becomes imperative, especially if sensitivity to sulfites is identified. Checking medication labels for sulfite content and steering clear of sulfite-containing products is essential. While there is no specific adult dosage for sulfites as avoidance is key, potential side effects include wheezing, difficulty breathing, and in severe cases, anaphylaxis necessitating vigilant avoidance strategy. Number 6. Certain antibiotics. Sulfa drugs. Antibiotics like Bactrim fall into the category of sulfa drugs and can induce allergic reactions or exacerbate asthma symptoms in susceptible individuals. Various case studies and clinical reports establish a link between sulfa drugs and bronchospasm, highlighting the importance of caution. Dosage depends on the specific antibiotic and condition being treated, requiring adherence to prescribed dosing schedules. Side effects may manifest as allergic reactions, rashes, or worsened asthma symptoms, warranting close monitoring when prescribed. Number 5. Statins. Although statins are effective in lowering cholesterol levels, some individuals might experience muscle-related symptoms that could mimic asthma-related issues. Research in the European Journal of Clinical Pharmacology indicates a potential association between statin use and muscle-related symptoms. Adherence to prescribed dosages, varying based on the specific statin and individual health factors, is crucial. Monitoring for side effects like muscle pain, weakness, or rare instances of liver problems becomes essential during statin therapy. Should you have any inquiries regarding your medication, we've crafted a dedicated book for your benefit. 10 questions everyone should ask their pharmacist. You can find the link in the description below. Feel free to explore it. Number 4. ACE inhibitor ARB combinations. Combining ACE inhibitors with angiotensin receptor blockers for hypertension treatment presents similar risk as ACE inhibitors alone, potentially inducing coughing that mimics asthma symptoms. Evidence from various studies emphasizes the increased risk of persistent cough with combination therapy. Dosage specifics vary and adherence to prescribed schedules is vital. Side effects might include dizziness, increased blood potassium levels, and the persistent cough often associated with ACE inhibitors. Number 3. Ibuprofen and other COX-2 inhibitors. COX-2 inhibitors like ibuprofen, beneficial for pain and inflammation, can worsen asthma symptoms in susceptible individuals, akin to other NSAIDs. Studies, including one in thorax, underscore an increased risk of asthma exacerbation with COX-2 inhibitor use. Careful adherence to prescribed dosages and schedules is essential. Potential side effects include stomach irritation, ulcers, and exacerbation of asthma symptoms. Number 2. Certain blood pressure medications, beta blockers, ACE inhibitors. Specific blood pressure medications, including select beta blockers and ACE inhibitors, can exacerbate asthma symptoms due to their effects on airway function. Avoidance or cautious use under medical guidance becomes crucial to prevent worsening asthma symptoms. Dosage specifics vary based on the medication and condition being treated, necessitating adherence to prescribed schedules and close monitoring for potential side effects. Number 1. Oral steroids. Long-term use. While oral steroids like prednisone are potent anti-inflammatory medications beneficial for various conditions, their long-term use can pose risk for individuals with asthma. Prolonged steroid use may lead to steroid-induced asthma or worsen existing asthma symptoms. Research has shown a correlation between extended steroid use and increased risk of asthma exacerbations. Dosage varies based on the condition and individual health factors, and strict adherence to prescribed dosing schedules is crucial. Side effects may include weight gain, mood changes, increased susceptibility to infections, and bone density loss. Navigating asthma management involves understanding medications that can potentially worsen symptoms. Avoiding or using caution with these medications, coupled with regular communication with healthcare providers, is pivotal for individuals with asthma. Always consult healthcare professionals before altering medication regimens and adhere strictly to prescribed dosages and schedules. Awareness of potential side effects and close monitoring can aid in minimizing risks while effectively managing asthma. Welcome to Dr. Vivian Medications and Natural Supplements. Our channel is committed to delivering valuable health and wellness insights crafted by a certified expert. In these challenging times, staying well-informed about self-care is of utmost importance. If you find our content helpful, please support us by giving this video a thumbs up. Your feedback lets us know how we're doing. If you'd like to see more of such content, consider subscribing and activating the notification bell to stay updated on our future videos. Thank you for tuning in.